Welcome back to More Than a Therapy Couch, the podcast where we go beyond the walls of traditional therapy sessions. I'm your host, Tiana. Ever felt stuck in a cycle of wanting to change but not actually changing? Maybe you've set goals that fizzled out before they've even gotten started. Why does it happen? And more importantly, how do we move past it? Today, we're going to talk about motivation, what drives us, what holds us back, and how to actually create lasting change. We'll dive into the science behind motivation, the stages of change, and how motivational interviewing helps people move forward, even when they don't feel ready. Unfiltered, no judgments, just you, me, and a couch. Let the session begin.
As a reminder, the topics discussed are for educational purposes only and are not meant to be taken as clinical advice. If you are concerned about you or a loved one's mental health, consult a mental health professional or call SAMHSA's 24-hour hotline at 1-800-662-HELP.
Today, I'll be speaking with Martha Pender, licensed clinical social worker and licensed clinical alcohol and drug counselor, who is a clinician who has experience using motivational interviewing with clients in their sessions. We'll explore what motivational interviewing is, how it works, and how it can be applied in various settings. Motivation is something we all struggle with at some point, whether it's starting a new habit, making a big life change, or just pushing through daily challenges. But what if I told you that even resistance to change is still part of the process? So, joining me is Martha. Thank you so much for joining us.
Thank you so much for having me.
So, just for the listeners, and just so they have a better understanding of your background, can you just tell us a little bit about how you got into the mental health field and what you love most about motivation?
Yeah, so I guess I've always kind of wanted to be a therapist. I think kind of came up for me like when I was in high school. I know in college I was a little unsure, but I decided on social work, and I just love being with people. I love helping people. And something that always really interested me was addiction. So a lot of my education was with addiction, and we actually talked so much about motivation and the change process. So for me, like, this is something I've always been really passionate about.
Absolutely. Let's actually define it. So what actually is motivation?
Yeah, so motivation can be defined as the reason or reasons someone has for acting or behaving in a particular way. And this is what really drives us to work towards whatever our goals are.
And I think it's definitely important for the listeners to understand that there's a difference between internal and external motivation. Do you think you could just explain the difference between the two?
Definitely. We talk a lot about internal versus external motivation. Internal motivation, or in other words, intrinsic motivation, is really what pushes us to work towards a goal that comes from personal factors. Whereas external or extrinsic motivation is what pushes us from our environment to either avoid punishment or gain reward. So the difference is we do it because we want to, or we do it to get or not get something in return.
Mm-hmm. And how do we know what's driving us?
Well, I think it really depends on what the goal is and our reasons for it. For example, oftentimes people discuss their health, right? So let's say someone wants to increase their fitness level. For them, an internal factor could be wanting to feel more comfortable in their body, to feel strong, to have a clear head, to decrease anxiety levels or even anger levels, But an external factor for that could be to feel better in their clothing, because the doctor expressed concern for their fitness levels impacting blood levels, like blood pressure, cholesterol. Those are more external factors versus what is driving us inside of us.
Mm-hmm. So it's what we actually want, for ourselves, or if something else is kind of influencing us to make this change.
Definitely. And, something to really keep in mind is that internal factors for motivation are oftentimes what's really going to be lasting when we make changes. Anytime we talk about motivation, everyone has external factors, right? Another example could be smoking cessation, right? We know we have nicotine in Zins, we have people who pack lips, we have cigarettes, we have vapes, right? This is something that's so big. And, so many people talk about there could be bad things that happen, popcorn lung, for example, is really coming up on the with the young people, and or even mouth cancer, with people with Zins. And yes, that's an external factor, and it's so easy to say oh, quit this, quit that. But we're not going to have lasting change if we don't want to do it. If our doctor tells us to do it, like, yeah, cool. Like, they're like, you shouldn't do this. But if we're not doing it for our own personal reasons, it's not going to be effective.
Absolutely. And how can motivation change over time?
So it can strengthen or shift to another goal. Something that I really like to note is that no one is ever really unmotivated. And I don't think anyone is really resistant to change, right? I think that a lot of times people can be ambivalent where we're kind of unsure, right? Like, is this something we want to do or is it not? And when we talk about motivation, it's not that we have like 0 or 100, right? I feel like we have a certain amount that's just there in us and it shifts towards different goals. So, for example, when we go back to smoking or even fitness levels, right? We might have 20% motivation to think about this goal, but 80% of us is still motivated to maintain that behavior. So I wouldn't say that it's there or not there. It's just shifting directions.
And I think one thing that you mentioned is too, like, part of the reason why some people are so nervous to make change is because it's the unknown. You don't know, you're comfortable where you're at. You don't know what your life may look like if you do make that change. And people get, I think, or some people may like overthink that and then start to spiral. And should I even do this? This is a good idea. So it's definitely something to, I think about when you do want to make a change and focus on like your why.
Definitely. And, you know, there's a whole change process, which I know we're going to talk about today. But I think for a lot of people, the first step is really understanding, like, what would it be like if change really happened to me? And like, am I ready for something to look different in my life?
So going off that, when working with your clients, how do you gauge their motivation?
So something that I utilize and many other clinicians utilize is motivational interviewing. And basically, for those who don't know what it is, it's a clinical method that we use to guide clients to increase their intrinsic motivation for change or internal motivation for change. So essentially what we do is first uncover what the goals are. And then I kind of determine like where we are with whatever goals they have. I think it's important to note that motivational interviewing isn't like a counseling technique. It's not something that we use that we could like necessarily teach skills with, but it's an assessment that clinicians a lot of times can use, or a method that we can use to assess, you know, clients' level of motivation.
And what are some signs that someone is ready or not ready to change?
Something to think about is a level of willingness to change. So we talk oftentimes about willingness versus willfulness. So willingness is about accepting what is and responding in an effective or appropriate way. But the opposite, willfulness, is trying to control the universe and deliberately or stubbornly doing something that you know isn't working, right? So when we talk about the signs that someone is or is not ready for change, I think a big part of it is the open-mindedness and the ability to say, hey, what I'm doing isn't working. This isn't effective. So now I'm at a place where I'm like, it's time.
A quote has came up a lot recently in my own life, and it's, I believe, by Albert Einstein, where it says nothing changes if nothing changes, or you do the same thing over and over. It's the definition of insanity if you want to get a different outcome. So just like think about that. Think about like, what are the things that you actually want to change in your life? What are the things that you kind of wish were different in your life? And then think about like what you need to change in order to get there. Because depending, like for me, if I wanted to go to the gym, okay, I need to think about, do I want to go to the gym before work? Do I want to go to the gym after work? Am I going to sign up for a gym? Am I going to just go on a daily walk? These are all different things to kind of think about, and think about what's realistic for you and what your goals are. Maybe right now I'm tight on money, so maybe I can't afford to get a gym membership, but maybe you can go on a walk, or maybe you can do, you know, some at-home workouts. There's a lot of different things that you can do, and I think that's definitely important for the listeners to note. So what is change talk, and why is that important?
So change talk, this is so important. Change talk is the language of change, okay? So this is indicating thoughts of change regarding whatever the target behavior is, right? So we talk about the desire for change. I want, I like, I wish, I hope to change. We talk about the ability to change, like having confidence in self, right? I can, I could, I'm able to change. The reason to change. So whatever those specific reasons are, like, this is why I want to. The need for change. So like, I have to, I need to, I must. This is important to me. Having commitment. So like, I will, I'm going to, I intend to. Having this activation. So like this willingness, this ready to, this planning for, and then actually taking steps. So like, we're showing evidence that we have specific actions that are helping us progress towards whatever goal we have.
And I think, change talk is really just proof of just showing like how you talk to yourself really matters, and what you say to yourself behind closed doors and your inner voice really can make a difference in your life. So if you say like, I wish maybe you're scrolling on social media, you see someone do, oh, I'm going out on my, 5-mile run. Oh, I wish I could do that. Well, why can't you do that? That's something that you can do. Maybe you may not be able to start out with 5 miles, but you could start off with a walk. You could start doing something. And I feel like even if you don't actually go out on that walk, if you think about going on that walk, that you're just planting the seed where at some point you'll have the motivation.
And, I think even when talking about change talk, so much of it is about knowing that we have the capability to do these things, like really believing in self. Because if we don't believe in ourselves, it's not going to be effective. So much of it that I talk about a lot with my clients is like this buying in process, like we have to believe the things that we're saying. And I think too, if we're not at a place where we're ready for a real change talk, I think it's about changing small ways that we could decrease the ambivalence towards whatever that process is. So for example, instead of saying like, I'll never be able to quit smoking, right? I'm not able to quit smoking right now, but that doesn't mean I'm not going to in the future. So it's about making these small shifts that we believe, right? Because if we never believe that like we're going to be able to quit something or we're not going to be able to start a goal, there's never going to be real change. So it's remembering that these small language changes make a big difference in what we believe in with self.
Absolutely. And definitely, I'm sure in the long run with setting goals and making sure that you're like reaching them, it's the little things and how you talk to yourself.
Definitely.
And how does important preparedness and confidence affect motivation?
So I think anytime we're feeling prepared to change, it's important to think about how important the goal is for us, how prepared we are to make the steps towards the change, and the confidence levels we have in our ability to make the change. I would say that these are some of the most important things to consider when we're gearing up to make change, and it can be displayed in how motivated we are, whether that's internal or externally. Like whatever that change is, that's like how we're gonna be ready.
Absolutely. So one thing that I want to ask you going off that question is what if someone doesn't feel prepared? What would be one thing that you would recommend if they are recognizing that they do want to make change, but they don't feel prepared to even make that change?
So I think this is why identifying like how ready we are in these areas is so important, because if we're not feeling prepared enough and we're not feeling like confident enough, this is where sometimes we need to reevaluate what the action plan looks like or that change plan looks like. I know we talk a lot about goal setting, right? And something I know we're going to talk about a little bit later is SMART goals. But I think like if we're feeling not prepared enough, it's about how we can adjust our goal to meet what fits us, right? Because if you have a goal, let's say your goal is to run those 5 miles, right? And you're like, I'm going to run a mile every day. I'm committing to this. Then I'm going to bump it up to 2 miles, like whatever it might be. And then you're like, I don't know how prepared I am. Like, can I make it? Is this realistic for me? This is where we then adjust the goal. And we're like, okay, let's say we're not running 5 miles in 2 weeks. Like, let's say we're running 5 miles in 6 months. So like, let's change up the timeline. Let's change up the smaller goals in the process. So if we're feeling unsure about like commitment or preparedness, we just need to reevaluate. And there's nothing wrong with that. I think too, remembering, when we reevaluate, it's never saying we're failing. It's saying, I know my capabilities. I need to build more confidence in this area. I know that I need to make more changes before I'm ready for this bigger change. So then we just start from there.
Absolutely. And I think that makes total sense. And another thing too, like if you are recognizing that you want to make these changes, if you don't have like an accountability partner, that is definitely huge. Obviously, you're more than welcome to do these changes by yourself, but you may feel a little bit discouraged if you don't reach that goal that you might have set. So just kind of evaluating that, maybe telling someone else about that, maybe seeking counseling and having your therapist hold you accountable. There's a lot of different things that you can do so that you are able to successfully make the changes that you want. And like finding your motivation and finding your why, you may not know why you want to do that. So it's nice to just talk it out and see why you want to even change these things.
And I think too, like you just mentioned, accountability person is so great. And whether that's a therapist, whether that's a friend, a family member, that is wonderful. But also learning how to remain accountable for self.
Absolutely.
Because, just like I talked about a little earlier, I think, we always talk about these external motivating factors. And that's another example of I don't want to disappoint this person. What is that going to look like? Are they going to be up my butt about it? So really too, remembering we can have these things, but also it's about us. It's not about the other person for change.
So we keep talking about change, but I think it's definitely important for the listeners to understand that there are different stages of change. And when you say that you want to change something, it's not you flip a switch and you change this, tomorrow. So what are the stages of change and how do they apply to real life?
So the stages of change is essentially this process that everyone goes through whenever there's a problem behavior, okay? Or a desired behavior. So there are 5 stages of change. There's pre-contemplation, contemplation, preparation, action, and maintenance, okay? So this was originally made for smoking cessation. So it's pretty cool that now we apply it to every other area. I actually forget the year that was, but that is the true fact. So pre-contemplation is when the problem behavior is not yet recognized, okay? So this is oftentimes when we're in denial and we're not seriously considering any change of the behavior. Someone may have had previous attempts of change, but since then, they've kind of given up, okay? Contemplation is when we're experiencing ambivalence about the change. We can see reasons to change the behavior, but we're still hesitant. So whatever that behavior is continuing, okay? Then we hit preparation. This is a lot of times when we talk about the reasons for shift in behavior. Like when we come to therapy, we're like, I want to make this change, but I'm not sure. This is oftentimes when we see a lot of people, okay? So preparation is when an individual has decided to change their behavior and they begin to think about it. During this stage, they tend to make minor changes to support the goal, but they may not have completely ended the unwanted behavior or really committed to the change process. So this preparation stage is basically what it says. We're preparing for whatever that change is. Then we have action. This is when we're taking significant steps to end whatever behavior it is or start whatever behavior it is. So this is when we're avoiding triggers, we're reaching out for help, we're taking other steps to avoid temptation of it, we're committing to the change plan, all those things, okay? And then we have maintenance. So this is when the changes made during the action stage are maintained. So we're continuing to face challenges, but at this point, we have successfully changed the behavior for a significant period of time. So the difference between action and maintenance is action is the beginning part of committing to it, where maintenance is when we're really maintaining that. So when we talk about new habits that we make, right? The preparation stage would be hey, I'm thinking about exercising more often. What would this look like, right? The action stage is saying, whatever change plan I have, I've now implemented it. And then the maintenance stage is 6 months down the line. We're hey, I'm still doing this. This is pretty cool.
Absolutely. And what would be some like real life examples of each kind of stage?
Yeah, so I guess an example I could bring you through is really smoking cessation, because, it's what it was made after.
Yeah.
So if we think of someone who is smoking, using any kind of nicotine product, whether that be, like I said before, Zins, doing dip, we're smoking cigarettes, we're smoking cigars, we're vaping, whatever that might be, right? Pre-contemplation is when we're in this stage where we're just actively using whatever product it is, and we're saying, I could quit at any time. This is not a big deal for me. I don't know why everyone's up in arms about it. Cancer will never impact me in my life. Like, no need to change, right?
Mm-hmm.
Contemplation is when we're like, I've seen some evidence that this might not be true. I am no longer in denial about this. And I'm like, this is kind of a problem for me, right? So we're kind of hesitant, but we're like, this might be something I need to consider, right?
Mm-hmm.
Then we reach this preparation stage. So we say, you know what? This is something I'm feeling more likely that this is what I want to do. I want to quit. What does that look like? Do we need to consider a nicotine patch? Do we need to consider Nicorette gum or a nicotine gum? Do we need to talk about finding a cup that we could drink out of because we need that oral fixation? Mm-hmm. Do we need to avoid people who are smoking? Do we not drink if smoking tends to happen when we're drinking? Whatever that looks like, right? And then the action is that commitment. So we're like, okay, today's the day. I'm quitting. I'm throwing this out. I'm using whatever action plan I have, right? And it might be difficult in the beginning, but we're avoiding the triggers. We are following our plan. We are reaching out to people for help. Maybe we found a support group. Maybe we found an online forum to be like, hey, like, this is really tough. And then 6 months down the line, we're still following our plan. We're maintaining that. A year down the line, we're maintaining that. I think, though, something to note, too, is that we can always shift spots in the change cycle. So it's not to say that we're in pre-contemplation and then we go to action. It's more like the other way. Like, if we go to action, we can always fall back into pre-contemplation and be like, you know what? This has been way too hard. Like, I don't want to make this change anymore. And that's where we talk about that motivation shifting. Mm-hmm. So remembering, it's not always like one, then the other, then the other. It can always shift around. Sometimes in addiction too, we talk about those slips, right? Mm-hmm. Relapse sometimes can be part of the process. It's not for everyone, but remembering you're not failing if you don't align with whatever this stages of change are. It's just that it's going to look different for everyone.
Absolutely. And I love that you said that. I think that's something that the listeners should make sure that they take note of. You are not failing if you do have to reassess your area of change or what you are thinking about changing. Just because you deciding to even make that change, I think, shows that you're willing and that you want to do something about it. You're not doing nothing. So I think that just shows a huge step in itself. But making change can be hard, especially if you have been living your life like this for a certain period of time. So like you said, taking baby steps, seeing what works for you right now, and then assessing down the line. You can always make bigger changes later on, but starting small is definitely the way to go.
Yeah. And, just to bounce off of that, I think too, like, the change process is going to look so different for everyone. And for you, just to remember, like whoever the listener is, reevaluating goals is the best thing about making change plans, because you get to say, hey, this doesn't work for me because this is about us. This is not about the expectations of others. This is not about whatever wants you to change. Like, this is about you and your life, and you're the expert. You get to decide what this looks like.
And you get to decide too, is this being too much for me? Is this not enough?
Right.
Like, if whether or not you can challenge yourself more and whether you're just trying to get the easy way out, that because you know yourself. So I think just making sure that you keep all of this in mind when you are evaluating when you do want to make change. And just know that you can make change at any point in time. But we are going to take a quick break where you are just going to hear from our sponsor, and we will be right back.
Today's episode is brought to you by Tree of Life Counseling Center, where people come to heal, deal, and learn to thrive. They currently have immediate availability for talk therapy and medication management with a team of over 50 licensed clinicians. Are you feeling alone? We all can use someone to talk to. Call 732-393-8391 or visit us at www.treeoflifecc.org to start your journey of self-discovery and healing today.
Welcome back. So, Martha, one of the next questions we wanted to ask you is, what is motivational interviewing and how does it help people move forward?
Yeah, so like I mentioned before, motivational interviewing is a clinical method that we use to guide clients to increase their intrinsic or internal motivation for change. So a lot of times we use it to resolve ambivalence and bring about behavioral change.
And what's one of the biggest misconceptions about motivational interviewing?
So something that's commonly stated is that it's a manipulation tactic, which it is not. It's important to note that motivational interviewing is about remembering that people make their own choices and others can't make it for them. No one is going to make a change if they don't want to, and they don't have any inherent motivation for change. I, like anyone else, cannot manufacture motivation. That comes from someone internally, right? It's more about eliciting someone's own arguments for change. I also think another thing to remember is that motivational interviewing is not a counseling technique. It's how we can be with people that uses specific clinical skills to foster motivation for change.
And I think that's too, if you notice that you want to change something in your life, motivational interviewing can help you navigate through all of the things that are in your head and all of the things that you want to do this and you want to do that. And do you even really want to do this? Or you're just doing that because you saw it on social media? What's your reasoning? What's your why? I think you need to figure out what your why is so that you have a better understanding of why you even want to make this change to begin with. Because what's the point of making change if you don't see the benefit of it? And especially if you don't see that, you're not going to see the benefit right then and there.
Definitely.
So why is motivational interviewing often used in addiction treatment and gambling addiction treatment?
So, like I said before, the stages of change were originally made for smoking cessation. And this is where, again, substances are substances. We're going to use whatever therapeutic approach works best for addiction treatment, period. Okay.
Mm-hmm.
So I'm going to refer to an article from SAMHSA, the Substance Abuse and Mental Health Administration. This is tip 35 on enhancing motivation for change in substance abuse treatment. Just so everyone knows, SAMHSA has free resources for clinicians. If there's anyone listening, you can always look up their information. They have great stuff that they upload pretty often. They have a variety of tips, and it can be really helpful for just general information and, for treatment approaches. But anyway, so historically, motivation was considered a static client trait. So they oftentimes believed that clients either had it or they didn't. And there was nothing a counselor could do to influence it, okay? So oftentimes, this led to blaming clients for their tension or resistance to change, which we now know is not their fault, right? Clients were seen as difficult. They would say things like, oh, so-and-so has an addictive personality that led to a substance use disorder. Oh, they rationalize this. They deny that. And that those are just characteristics of people with addiction, okay? So they say that, oh, resistance is a characteristic of unmotivated clients. And they oftentimes believe that confrontation was effective. Now, there's a difference between being challenging as a clinician versus confronting clients. Mm-hmm. Again, we can't make someone be more open to change, but this was just a really aggressive approach, right? So with research, they found out that the following were more effective: focusing on client strengths, and we need to focus on individual and person-centered treatment. Not that there's just a blanket treatment plan that we could use for everyone, but that everyone's an individual. Everyone needs different things, right? It's important that we're not labeling clients. So really using person first language. Like someone's not an addict. They're not a gambler. They're a person that struggles with addiction. They're a person that struggles with whatever it might be. Someone's not just bipolar. They struggle with bipolar disorder, okay? We also need therapeutic partnership. So this is a collaborative process. I am not the boss in the office like they are, like we work together. And that we need to really use empathy with clients, not authority and power. And they really looked at, there are huge benefits to brief interventions. So like I said before, motivational interviewing is a therapeutic method. This is a brief intervention that clinicians use that could help foster motivation. So due to the benefits of those brief interventions, this is an effective way to use personalized feedback of a client's struggles. The focus and the motivation strategies are tailored to a client's stage of change, and it's a brief intervention which allows us to provide treatment that's most appropriate for the client. So we're really looking at, hey, this is not again, a blanket treatment. This is something where we're taking each person into consideration. We're understanding where they are, what needs to happen, and then we can help them make change.
And I think I love that. I think that's something that's really, really important for the listeners to take note of, just because I think even just like the idea of therapy, some people may think, okay, well, what works for you, maybe someone says, hey, try this. Hey, try that. Hey, try this. Hey, I've tried all these things and none of these things are working.
Yeah. And, I think this is also where like each person is going to find their therapy person, right? Like every clinician isn't for everyone. But remember, like if you're ever feeling like, this therapist isn't taking what I want into consideration, have a conversation with them about it. Or maybe they're not for you. It's finding the person that jives with you. It's finding the person that believes you and listens to you and validates you, but also challenges you. And remembering they could challenge in a way that you may not like all the time, but you need to be open to that.
One of the things we talked about on one of our last episodes is advocating for yourself. A therapist can't read your mind, believe it or not. So you need to make sure that like, hey, this is something that's been going on in my life, or hey, this is something that I've thought about and I think I want to change this. Talk about it with your therapist. Your therapist isn't going to know that you want to work on things, especially if you've been seeing your therapist for a bit. Maybe for what you originally came to counseling was one reason, and now something else has changed in your life and now you want to work on something else. Your therapist won't know unless you advocate for yourself and unless you're honest and open to wanting that honest feedback. Because once you open that can of worms, it's not like, oh, well, actually, no, I don't want to focus on that anymore. Well, okay, well, now the therapist is going to be like, well, okay, if you don't want to do all of that, then fine, but I'm still going to try to nudge you into that.
Yeah, and also remembering, like, it's okay if we're not ready, but it might come back up.
Absolutely, and I'm sure as therapists, that's something that you guys can definitely bring up to clients to challenge them. Hey, is there a reason why you decided that you didn't want to maybe stop smoking all of a sudden? Right. Has something been going on in your life that's been kind of stressing you out more where you feel like you need that? So that being said, though, can motivational interviewing be used outside of therapy?
So I think that motivational interviewing would be great in so many different like scenarios, right? It could be good with coaching. It could be good with like in therapy. It can be good with like a boss. But I think it's important to remember that it's something where someone needs to be trained on it. It's not something that's easy. It's not something where it's just like, oh, I'm going to ask these questions and they're going to feel more motivated. So I think oftentimes like motivational interviewing is technically used in a therapeutic like space. So please don't try to research this yourself and do it yourself. Talk to a clinician, talk to someone who's certified if you want to, talk to someone who's been trained in it. Don't try to do it by yourself.
But one thing to note is that if you are listening to some of the things that we're talking about and you find, oh, this may be really beneficial or maybe I may benefit from this, you could call our office. We have multiple counselors that have experience with motivational interviewing. You can even go on Psychology Today that you could look up specifically who has experience with motivational interviewing. There's a lot of different things that you can do, but This is unfortunately not something that you can do by yourself. Making the decision to change can be very hard for some people. And I think something that we should kind of talk about is what actually leads someone to make a change.
Yeah, so I think this is where we have to refer back for the motivating factors, right? Are we feeling internally or externally motivated? What is the goal, right? Why is it important for us to reach the goal? Like the whys you're kind of talking about. It's important to notice like what's stronger, external or internal motivating factors, right? But I'm going to refer back to TIP for a little bit, okay? So in the stages of change, in preparation, a lot of times what happens is we can use motivation strategies to strengthen our commitment and help people make a firm decision to change, right? So clients who commit to change and who believe change is possible are prepared for the action stage, okay? So for clients who are actively listening or people who are actively listening, that's when we take steps to change the behaviors to have better long-term outcomes after treatment or when we're ready to make the change than for those who have not reached this stage in the stages of change. Your task is to set clear goals to change in preparation for developing a change plan.
That makes total sense. If you know that you want to change, but you don't know what exactly you want to change, figure out what are your goals. And then from there, you can figure out, okay, what do I need to do in order to accomplish that goal?
Right.
And breaking it down. And how can our listeners benefit from a cost-benefit analysis?
Yeah, so cost-benefit analysis is a great tool. You could look these up online or talk to a clinician if you're curious. Sometimes they're called decisional balances. But essentially, what this is a ramped-up pros and cons list, okay? So a cost-benefit analysis is a tool that we can use to increase our awareness of long and short-term benefits and cons of a decision. So we use this to break down any decisions we have, whether it's deciding we want to go to whatever college, buying a new car, ending a relationship. If we want to quit something, this can be a great tool. So again, you can look these up online. They will literally explain the directions on it, but it'll also help us better identify what's most important to us in the change process. If we're looking at short-term benefits guiding us, like we need to look at more long-term things, and that might help us just really break down what will help us to decide to change.
Especially when making a change can be so overwhelming at times, or especially even just like the thought of like, where do I even begin can be very overwhelming for some people. That's something that I think the cost benefit analysis would be really great. You see it on paper, you can see it all laid out, and you get all of your overthinking thoughts out on paper. And sometimes it's nice to just like see it all there and then be able to assess.
Definitely, oftentimes I hear like, I don't know, there's just so much in my head. And it's like, let's just write it down, I even use this tool from time to time if I have a big decision coming up. So I'm going to really encourage you guys to take a look at that. It's something that's so helpful in so many different aspects. And again, it's something then we could revisit of like, hey, something else came up. Like, let me write this down. So it'll really help in that process.
So you can use the cost benefit analysis to evaluate why you want to even make these changes, evaluate the reasons for these changes. But what happens when someone wants to change but doesn't take action?
Yeah, so I think this happens so often, right? So this is oftentimes when we remain in preparation or we might return to contemplation or pre-contemplation in the stages of change. Sometimes we just need to revisit goals and figure out a better starting point that feels more effective for us. And remembering, again, it's not a failure. It's just another step in the process.
Absolutely. So one thing to keep in mind is if you do realize that you do want to change, you do have to take some type of action, whether that's starting writing things down on paper, having a conversation with a therapist, doing something. Just because with you not acting on that change, you're doing nothing in order to change. So we will be right back right after this quick sponsored break.
Feeling stuck mentally and physically? It may be time to supplement your self-care practices with some holistic healing options. Mind the Body Holistic Wellness in Freehold, New Jersey proudly offers a variety of healing modalities, including Reiki, massage therapy, reflexology, and Himalayan hot stone massages. For more information or to book an appointment, visit www.freeholdnj.com. www.mindthebodyhw.com. Now back to our show.
Welcome back. So, Martha, does resistance to change mean someone isn't progressing?
So definitely not. I want to highlight that I wouldn't say that anyone is necessarily resistant. They're just ambivalent, okay? So this is once again where we look at willingness versus willfulness. So whether we can acknowledge the reality and look to need to take action, or really dig our heels in and say, like, I'm not changed, depending on like that reality. Like, it doesn't mean that someone is resistant to it. Again, it just means that we're not feeling motivated for it. And again, we could look at the stages of change and remember that we can dance with the discord. And I think that's a new phrase that's come out a lot in clinical terminology, to notice that like clients aren't going to be resistant. People aren't resistant. We're just like feeling unsure. And just to define it, just so everyone knows, because I know I've mentioned ambivalence. Ambivalence is a state of conflicting feelings, while resistance is a tendency to oppose or reject suggestions. So again, there might be feelings of resistance, but no one is resistant. It's important not to label ourselves with such a blanket statement. Like, we're not putting this across our forehead of like, I'm resistant to all change, right? Like, we're just having conflicting feelings about it.
And I think that's why therapy is so important, just because a therapist can help you navigate those conflicting feelings, can help you figure out what is most important to you. Maybe things have changed so much in your life that you don't know what you value and what you hold near and dear to your heart. So maybe that's something that you need to evaluate and see what in your life resonates with it and aligns with that, and then evaluate and make a change. But how can we reframe resistance to actually help with change?
Yeah. So again, I think this is where we need to acknowledge the feelings that are coming up when we're feeling like, I don't want to make a change here. And who is saying that we need to make change? Are you saying I need to make a change, but I don't want to? That's not resistance. That's ambivalence, right? Or is someone else saying there needs to be a change here? And if they are, why is that? And again, that's where we look at those external or internal motivating factors. Like, all right, we're not really resistant here. Like, we're saying someone else is saying it, and now I have to evaluate this. What does this mean, right? So just taking a second look at that.
And what are some common mistakes people make when facing resistance?
So this is huge, right? This is a lot of times when we give up. We see some clients that are making goals that are way too big and unachievable, or goals that are so small that don't allow us to see progress, okay? So it's important to take a break and reevaluate the overall goal to shift some of the change plan. So if we even jump back to that 5-mile goal that you talked about earlier, right? The too big of a goal would be 2 weeks I'm running 5 miles when I haven't run in 6 months, versus saying, I'm going to run 1/10 of a mile every day. Like, you're not going to see any progress there, right? So it's important that we find something that's tailored to us. And remember, it's very easy to show evidence of saying, I can't do this, because we have no evidence to show that there's been change. So you also have to give yourself opportunity and buy into the process.
Even if we're using the topic of like running, for example, think about marathon runners.
Yeah.
They didn't just wake up one day and be like, I can now run a marathon, and I never ran ever before in my life. They've worked up to that.
You know, like, I can give a kind of an example there. You know, I used to be a swimmer. I know I've told some of my clients this. I swam in college, Montclair State University. Let's go. But, you know, I remember, like, I oftentimes did open water mile swims, and it would be something that was so easy for me back in the day, because I would be training every day all summer, and it would be like just something fun. A couple of years ago, I decided to do an ocean mile, and let me tell you, I did not train appropriately, but that did not mean that I didn't reach my goal and that I was resistant to it. It's just that, you know, I had to shift it. I had to say, you know what, I haven't been swimming in a couple months. Like, let me get back in the pool, or let me swim at the beach a little bit so that I can get back in shape to swim a mile.
Even too, with like that example, let's say your time, I don't know what an average time for that would be, but let's say an average time was like 10 minutes to swim a mile.
A little slower, more like 40 probably.
Oh my gosh. Okay. So, but on average, let's say in college, like you did maybe
like
an average
28 minutes is more like a college time.
Yeah, so let's say your college time was around like 25, 30 minutes. Your goal now, like if you haven't swam in X amount of years, I just want to complete the thing.
That was my goal. Yeah.
As long as I do that, I'm fine.
And I might have died at the end, but you know what? I did it. So
exactly. And
the
that's
goals
all that matters. Exactly.
Yeah.
Speaking of goals, setting goals that actually stick. So how can our listeners actually make sure that they're setting goals that are achievable?
Yeah. So what achievable is for everyone, again, is going to look so different. If we define what makes a goal achievable, it's something that could be reached successfully, okay? So a lot of times we use a framework of SMART goals. I love worksheets. I will say there are so many worksheets on SMART goals. So SMART is an acronym. SMART stands for specific, measurable, attainable, relevant, and time-oriented, okay? So when we set goals, it's important to keep all these things in mind. Because I think oftentimes, we'll talk about like New Year's resolutions, for example. Someone will say, like, let's talk about health goals, for example. Let's say someone's like, I want to be more active. Okay, great goal. What does that mean? What does that look like, right? So this is where we could be specific of like, what would a realistic fitness goal for me be? Is it working out twice a week? Is it working out 3 times a week? What does working out mean? Is it just putting our shoe, like being intentional about doing something that's active? Like, are we putting on our workout shoes and workout clothes and we're saying, I'm doing 20 minutes here? How are we measuring it? Like, what does this look like? Like, what does it mean when we complete it for the day? Again, is it those 20 minutes in those clothes? Is it attainable? Is this something that fits in our schedule? Is this something where, we know that we can do this and we have confidence that we can? Is it relevant to our life? Like, is this important to us? Looking back at that importance scale that we kind of talked about earlier, like, how important is this? Is this something where it's like, well, people say I should, and I have some external motivation, but like, we're not going to follow that. And then to me, the biggest thing is time oriented. We need to take a look back and say, okay, so I looked at this month. How did it go? Do I need to change my goal? Do I need to reevaluate it? Do I need to amp it up? Do I need to make it less? And looking at this time-oriented section, this is where we could look back and say, did I build confidence? Do I know if this is something I can maintain? Or is this something that's like way out of line where I can't maintain it?
One of our last episodes, one of the therapists that we had on, she mentioned something about saying like, if we go again with the topic of like fitness and working out or just even moving your body. Okay, I'm going to set a goal of I want to move my body maybe an hour and a half per week.
Right.
Doesn't matter. We're not going to set it for a specific day. Doesn't matter what days. You just want an hour and a half a week to move your body. If you exceed that, that's amazing.
Great.
You feel great. But then if you at least did that hour and a half, okay, I've reached my goal. So it's like setting something, like you said, that's realistic, I think is very important. But then also evaluating that. You could set a goal and say, okay, I'm going to quit vaping. I could quit vaping 15, 20 years from now.
Right.
When do you want to actually quit? When do you want to actually reach that goal? And I think that's something that's really important to evaluate and reflect on.
Definitely.
And what role does self-advocacy play in terms of reaching your goals?
So it's so important to utilize self-advocacy in all of your goals. So again, I like to tell my clients this all the time, like, you are the expert in your life. You get to decide what goals you want to achieve and what goals you want to set. No one else can determine that. Just like I can't manufacture motivation for change, I can't tell you what's going to be best for you in your life.
And what are some common mistakes people make when setting goals?
So some common mistakes people make in setting goals is that they're either setting goals that are too big or too small, kind of like I stated before. And they're also not using time limits for reevaluation. Mm-hmm. I always emphasize the importance of reevaluation and time limits. I think this is one of the most important parts of the goal setting process. if we reach whatever goal we have, if we make a small goal, let's say to build confidence, right? We need to say, how difficult was this for me? Was this something I breezed through and I'm like, oh yeah, like I could do anything? What would it look like to really amp the goal up a little bit? Can we do it? If we can't, again, not a failure. We go back to what the last goal was, and then we keep moving forward. So remembering, like, we need to reevaluate at times, because that's how we're going to continue to make progress. It's not going to be like, oh, I reached it and that's it. Sometimes we need continued growth.
And depending on what that goal is, your goal may change. Maybe your goal was to have a job in this field, and now you reach that goal, and now you're not going to go backwards in terms of that. You want to make more money, right?
Right.
Or
even learn more.
Exactly.
Right.
Yeah, absolutely. Do you want to further your education?
Yeah.
So these are definitely all things to kind of keep in mind. But shifting gears a little bit, when to seek professional help. So you stated earlier that motivational interviewing is not something that our clients can do by themselves, but they can definitely do certain worksheets to help figure out goals and help organize their goals.
Yeah.
So what are some signs that it may be time to see a therapist, especially if you set goals or you keep feeling like, oh, I didn't reach this goal, or I want to do this and I want to do that, and you feel a little discouraged?
Yeah, so I think that this may look different for everyone. I would say if we're struggling to cope with the stressors of life or becoming emotionally overwhelmed, it definitely can be something to consider. I also think that if we're feeling like we need more support, this is a great space for it, right? And, professional help is going to look different for everyone. I'm going to recommend someone maybe talk to even a provider. I know they do some mental health screenings now with general practitioners. They have been for a while. So, if you're struggling, tell someone, tell a doctor, tell a therapist, tell a coach, anyone.
And how can professionals help when motivation is feeling low?
So it's important to remember that, like, we're here to support you no matter what's going on in your life. I know motivation can be low for so many reasons. We could feel discouraged. We could be feeling symptoms of depression. We could be feeling overwhelmed with anxiety. Whatever could be going on in your life, like, we could just be feeling like unprepared and not confident, not having the esteem. But it's important to remember, like, we're here to listen and to support you with whatever you may need. We're not going to push you more than you can handle. We're just here to be here with you.
For the people who are listening right now, are there resources available for people who may be struggling with motivation?
So I think if we're really struggling with motivation, again, I would definitely recommend talking to someone about it, like a doctor or counselor. If we're needing inspiration, though, I would definitely check out like a mental health podcast like this one. There are different forums for support online. I know some people talk about Reddit forums that they're on. Some people talk about, a variety of different online blogs, stuff like that. I also think that something that can be helpful is like self-help books. There are so many good ones out there. I definitely recommend checking out your local Barnes & Noble, or a plug for the library. Push it for the library. They have all the self-help books. Listen to an ebook. So sometimes too, we just need someone else to point things out to us in a different way. So I definitely recommend listening to some of those or reading them.
And are there support groups that exist for different challenges?
Yeah, so, I am licensed in addiction. So, of course, I'm going to plug all the addiction stuff. There are so many good support groups for people struggling with addiction. There's Alcoholics Anonymous, Narcotic Users Anonymous. There is Marijuana Users Anonymous. They have Crystal Meth Users Anonymous. They have Cannabis Users Anonymous. They have Smart Recovery, which is another type of support group. They have groups for family members. So they have Al-Anon, they have Nar-Anon. Those are for people whose family members struggle with addiction. They also have a group that's called Adult Children of Alcoholics. So if your parent is, you might feel like that could be a good group for you. So, totally forgot to plug gambling addiction. Let's go. GA is great. Let's go. Gamblers Anonymous. They have so many different websites. Most of them are whatever the group is, like AA.org, NA.org. So you could Google these really quick. They have apps online to look for meetings. Again, it's just remembering like whatever is going to work for you. If you're looking for a local support group for mental health, look on Psychology Today. That's a great resource. You can call our office at Tree of Life. There are so many different resources out there. Don't forget to look because they're always there.
And we will link some of those websites down below as well. But we are just getting to the end of our episode. So, Martha, what is one small action step listeners can take today?
I want to talk about language that we're using, okay? We need to talk about potential for change for us. You know, it doesn't matter what stage of change we're in. It doesn't matter what's going on in our life. We have to remember to talk about change as being a possibility.
So if you found this episode really interesting, if you feel like you benefited from this episode and you learned something, feel free to let us know. Feel free to share this with someone who you think would benefit from listening to this episode, because we all can use a little bit of motivation. And we will see you on the next episode where we talk about more mental health tips.
Thank you so much for having me.
Thank you for coming on. Bye.